Presentation titled Auditing During the World's Longest COVID-19 Lockdown comes to us from Cameron Clark. Cameron is a highly experienced auditor with more than 10 years as a certified Exemplar global auditor for OHS management systems, completing large and small audit programs as part of self-insurance requirements, management system certification, and internal insurance programs. He is also a Queensland government-approved self-insurance auditor. Cameron works carefully with organizations to identify the objectives of their audit program, refining audit approaches to better engage with those being audited and minimizing the strain and anxiety that audit programs can cause to deliver a beneficial program that focuses on improvements that can have a truly material impact on an organization's performance. His auditing experience has been drawn from a wide variety of industries in Australia, including from defense, air transport, local government, healthcare, manufacturing, property management, transport and logistics, retail, and finance. And with that, take it away, Cameron.
Thanks very much, Mike. And thank you to everyone for coming to this Exemplar Global Online Expo presentation. I wanted to start by just speaking about how much we rely as auditors on what we see and what we read and what we hear. And during COVID-19, with many of us working from home, we started to wonder as an organisation just how much we might lose if we lost the ability to see what we were auditing. And given a picture tells 1,000 words, we did kind of wonder how much we would lose without a science inspection. Today, I'll work you through a bit of an agenda. I'll talk to you about who we are and COVID-19 in Australia and then in Victoria. That provides just a bit of context for some of our decision-making during the pandemic. We'll also talk about the responses from governments and regulators and certification bodies, both initially following some of the very first cases and then subsequently with the first and the second wave. Following on from that, I'll talk about what our response was, what we thought we needed to do and how we did it. We'll talk about the analysis that we did both internally and also with our clients to understand what we might need from anything we might decide to use to improve our auditability during the pandemic, as well as talk about some of the options we looked at, particularly technology options, both the current technology that is available on the market and some new and emerging technologies that are just coming through in the last year or so. We'll talk about what we thought was the best solution for us, as well as some of the workarounds we had to implement. I'll review what we thought was the results of the new technology we were using, whether it was effective, whether there's any further outstanding issues, as well as discuss what would happen going forward. When the pandemic's over, will we still need some of these methods to audit remotely, and whether there's anything else that we need to talk about or anything else we need to improve to really make this a viable method to audit when you can't get onto site. So who are we? Well, Veris is an Australian-owned small and medium enterprise. We're based in Melbourne, Victoria, and we have offices in Queensland, in Brisbane in Queensland. We operate across Australia and New Zealand. We are specialists in health, safety, consulting and auditing, and we tend to work for global, national and blue chip organisations, include supply chain, logistics and warehousing, big box retail, banking and finance, both national and global food manufacturing, local, state and federal governments. We work with the fast-moving consumer goods as well as the aviation industry. And generally our clients are split between about 70% auditing clients and about 30% consulting clients. Okay, COVID in Australia. Much like many parts of the world, the initial response happened around March 2020. It was pretty much Australia-wide, some of the early response, and it was really designed to flatten the curve as many countries were trying to do at that time, and predominantly trying to do that through social distancing and minimising the amount of people gathering internally. That initial response happened after the first COVID case on the 20th of January in 2020. It was a visitor from Wuhan in China. The first wave occurred from about mid-March to mid-May. This included border closures between the states of Australia. At a more local level, things like schools were closed, working from home was encouraged wherever possible. International visitors were required to quarantine in hotels for a period of 14 days before they were allowed into the community. And anyone who was awaiting a COVID test or experiencing symptoms or part of contact tracing, of course, had to isolate at home. The end of the first wave in Australia and in Victoria happened around May 2020. Restrictions start to relax and many organisations return to their workplaces. Household and other gatherings are now allowed as well. But moving on from about that mid-May area to the second wave that hit Victoria predominantly in Australia, and that second wave hit around mid-June to early November. It was the result of a failure of hotel quarantine where an international visitor staying in quarantine, there was transmission to a hotel worker who was then working and living in the community. That resulted in a number of restrictions being reintroduced, and probably one of the first really significant restrictions was some specific postcode lockdowns where about 10 different postcodes in metropolitan Melbourne were issued with a stay-at-home order. Borders to Victoria were also reclosed, and ultimately there was a full lockdown of metropolitan Melbourne across about 10,000 square kilometres. Continuing on, face masks are now mandatory everywhere outside of your home, and there is what's known as stage 4 stay-at-home restrictions. These effectively limit the ability for anyone to leave their home for only 4 reasons: to go and get essential goods like food, for exercise and recreation, to a limit of 1 hour every day. We also had limits on outdoor gatherings, so if you were exercising for that 1 hour, you could only exercise with one other person. You're allowed to leave home to provide or seek care, and you're allowed out of home to work if you were an essential worker. There were heavy restrictions on visitation to aged care, as well as a curfew between 8 p.m. and 5 a.m. There was a 5-kilometre travel radius that we were allowed to move within for shopping and seeking care and other such things. Those 4 reasons we could stay at home, but we weren't allowed outside of that 5-kilometre radius without a travel permit. And if you were working and you were an essential worker, there were density restrictions in many of the workplaces that were allowed to continue. For example, construction sites were only allowed 25% of their workforce on site. And that second wave of restrictions lasted for a grand total of around 112 days. At the time, it was the longest lockdown in the world. This graph just shows you the first and the second wave. You can see here, which is when the first Australian case was identified, some early social distancing in March before some national lockdowns and border closures. Then we were pretty good for a while, but Victoria announces some additional restrictions on the 20th of June. We have the postcode lockdown occurring for about a week before the full Melbourne metropolitan lockdown goes into effect. And from the very start of the first wave to the second wave lasted about 7 months. So we had about 6 weeks in between. Otherwise, we were pretty much locked down for the entirety of 2020. The response to these lockdowns were varied depending on different parties. So governments were very much limiting gatherings. They want people to work from home. They don't generally regard professional services like auditors as essential. And so we're pretty much stuck at home, the entire company. Certification bodies are starting to defer auditing requirements with some of the uncertainty. They're also promoting remote auditing techniques to try and keep some programs going. Regulators are also deferring some auditing requirements that they have. They also are now requiring COVID notifications for any known COVID cases within workplaces, so that contract tracing and other such things can begin. Clients start to, their initial response is they're really just fighting fires. They have a number of COVID-19 incident responses that they have to implement. Myself, I was with a client in late February when there were a number of incident reports coming through of people having COVID-like symptoms, and phones and text messages going off left, right, and centre. We quickly established that the audit we were in could no longer continue. Clients also start to implement some internal bubbles to keep their people separate so they can keep their businesses going. And they generally suspend all of their network-wide audit programs. They only allow essential third parties onto site, and generally these are only third parties that are essential to the operation. So it's maintenance personnel for equipment that's broken down, and other such things. Auditors and consultants are way down the bottom of the list. But beyond the initial response, things did start to change. So it was probably sort of sitting after the first wave, and regulators are now starting to become uneasy with further delays. And they start encouraging remote auditing with phones and other such things like tablets. Clients also change. So they start to get their fires under control. They start to get some response and business continuity plans in place. And they tend to, they start to understand what working during COVID is like, and it starts to become a business as usual. But with that business as usual, the senior leadership starts to think about the other parts of the operation, not just that they're managing COVID. They start to seek assurance that the rest of the business is performing as it should. And they start to make some attempts with smartphones and tablets as well. So amongst all of this, we're considering lots of our responses at about mid-June of last year. So just as some of those additional restrictions were starting to come back into Victoria after the first wave, we're experiencing clients that are hungry for assurance data, but we do have travel restrictions that are starting to be thought about. We don't want to cross borders in case borders close. Regulators are, as I said, regulators are uncomfortable with the delays. Global cases of COVID are exploding at this stage to a tune of about 150,000 per day. I know that got a lot bigger later in the year, but at the time it was getting bigger every day. And we're also seeing the first signs of the second wave in Victoria. And we know that restrictions are coming. So in the context of that, we start to think about what we can do, and we start to recommence some of our audit programs remotely. We're using video conferencing technology to complete interviews. We're using cloud-based storages to obtain records and documents for review. We start to increase the sample size of records and of interviews to try and supplement the absence of site inspections. And we start to use phone and tablets for site inspections as well, both with some still imagery and some moving imagery. And in doing so, we start to understand that we don't believe our remote auditing service is really providing the value to our clients that they were used to. So we really started to think we needed to improve our auditing ability remotely. We think the teleconferencing and video conferencing is working pretty well. It's working pretty well as it works because everyone is kind of decentralized now, working from home. So we need these kind of technologies anyway. We think the cloud-based document storage is working reasonably well, though it can be a little clunky at times. But overall, those two things are pretty well down pat. But we do really start to suspect that the remote site inspections are really not helping us out. And most of that is because we're using consumer devices. And as good as the cameras and other things are in our smart devices nowadays, these devices really don't produce a very good quality image when we're streaming those images live. And they're small images, they're designed to be on small mobile phone screens, and they're really not helping us to see what's happening on site. So we start to analyse what we think we're going to need from any solution that we might adopt. We understand image quality is absolutely paramount, but we also understand that the better the image quality in these streaming images, the better the battery life you're going to need, because it will drain your battery very quickly. We know any technology has got to be shared across multiple clients, so we know they need to be reliable and robust. We want to stream the video, so we know we need to be able to connect to a network. We're giving these, potentially giving these devices to people for a one-off. So we really want there to be ease of use and ease of adoption. And we know many of our clients have different types of work sites that that we want to be able to visit and use the same device at each one. But we also talk to our clients, and they come up with some of the same ones, but they also come up with a number of different ones. They're very keen on understanding how we can maintain the hygiene of these, of any technology we might use, in particular because they might share it amongst their own people, and it's obviously being shared amongst our different clients. They're keen to understand the security and privacy capabilities of any technology, wary that streaming images of their back of house areas to a remote location could compromise their security. They want to make sure that their people are safe and that any PPE that their people have to use is compatible with any device we might ask them to use to help us with remote auditing. They also want the units to be easy to use. They don't want to waste time trying to learn how to use these things during these audit programs. They highlight network connectivity as well, but they have different issues in that they don't want an outside device on their network, generally due to their IT security protocols, and it's very difficult to get the approval to get on those networks. And they also have some high-risk work environments that they want to be able to use these devices in. So with those needs, we started to look at what the options were that were available to us. And we started with smartphones and tablets, which we pretty much already decided wasn't going to cut it, but we did the assessment anyway. We saw that they were certainly affordable, they're robust, we use them every day, they're designed to connect to the network, and it wouldn't be a big learning curve for anyone to have to use these things because we're very familiar. But as I said, image quality is not great. The security and privacy of these things are a concern to our clients in some ways, because we can control some things and take images that they may not be aware of. And we weren't sure that they were going to be good in high-risk environments, with many of our clients prohibiting mobile phone use on operational floors. The second option we looked at was your action-style cameras or your GoPros, and certainly image quality here is great. They're very robust and very reliable, and they've got great battery life. And, you know, if you see where they're used, they can obviously be used in high-risk environments. Our clients also thought it could be worn as a body camera, which would they might find more preferable than someone walking around with a mobile phone. But security and privacy, network connectivity, and the ease of use were issues. Security and privacy, again, these devices often record images to the internal hard drives, and we'd have access to that when the devices were returned. They also need a mobile phone or other device to connect to the network, which means that we still have to have a device along with this one that our clients would have to come with. They would need the app to connect to the device and other such things. And generally all that connection and then trying to get a streaming image was not an easy thing to do and required a fair few steps to get through. And we didn't think from an ease of use point of view, it was going to satisfy us. After that, we started to look at your kind of smart glasses, the prosumer or consumer smart glasses. These things are designed from a network connectivity point of view. They're reasonably robust and reliable in that they're just one piece. They do have some security and privacy capabilities in that the wearer of the glasses often has control over whether images are being taken or recorded. And they're pretty safe, and they, you know, you can put them on, and we didn't think the adoption would be too difficult. Unfortunately, the image quality on a Google Glass style pair of smart glasses is, it really wasn't to the level that we could use. The size of these glasses and the scale of them meant that they have smaller cameras, they have smaller batteries, and they have smaller processors. And all of that really went against being able to use them in the field. Finally, we looked at some industrial smart glasses, and image quality here is much better, as is battery life. We have a bigger unit. We're able to have bigger processing and bigger cameras and bigger batteries, and they all worked quite well. Similar to the Google glasses, you're able to control, the wearer of these glasses is able to control what the person remotely might see and hear. They can turn things off. They have to confirm if we want to record the streaming video that's coming through. They're able to connect to the network because they have Wi-Fi and Bluetooth and all these kind of things. And many of these industrial style glasses are safe and compatible with PPE, with many coming with things like hard hat attachments and the ability to connect them to safety glasses. But from an ease of use point of view, they're not perfect. They do look a bit big on people when they wear them, and people can be a little bit circumspect. There's also multiple pieces here that people have to put together, and those multiple pieces also are detrimental to being able to maintain good hygiene with these things. But overall, after sort of looking at all the solutions, we decided that probably the best available solution out of those four were the industrial smart glasses. And that was primarily because of a number of reasons. The first one being image quality. With these industrial smart glasses, we're able to stream high definition live video to our computer screens. They're designed for the video that comes to the auditor is designed to be displayed on large screens. And we also have stabilized optical in the glasses, meaning that the sort of shaking and shuddering that you tend to see when people are holding something is eliminated, and we got a much better picture there. Secondly, had really great battery life. So the solution that we used, we could stream in high definition for up to 2 or 3 hours. And if we needed to go longer, there was also the capability to sort of hot swap these batteries without the image being interrupted. So you get a quick note saying your battery's going flat, you'd be able to unplug and re-plug another one in before the image stopped. As I said before, they're safe and compatible with PPE, with various attachments to enable them to be used with other PPE. They've got good water and dust proofing, they're PPE compatible, and because people weren't holding them and they could just wear them and not be distracted, our clients were more comfortable using these kind of devices in high risk environments as opposed to people holding onto a mobile phone. While they weren't fantastic from a hygienic point of view, there was a couple of points that there was one attribute about these things that really made them useful, in that they had an integrated speaker, which meant that the end user would not need to wear earplugs or share headphones, which would be quite a strong way to promote community transmission of infections. And we were really keen to find something that had that integrated speaker. And finally, they are pretty secure and pretty private, with the end user needing to be the one who is recording the image or allowing any of the remote controls that the auditor might try. They get to confirm any of those functions before they actually happen. But it wasn't the perfect solution. There were still some outstanding issues. So, from a network connectivity point of view, our clients were still uncomfortable, regardless of the device, about getting them on their network. And we also found that many clients had some variable network quality, which meant that if we were going to these sites with the glasses, or the glasses were going to these sites, we couldn't be certain just how much bandwidth we were going to be able to use. Ease of use wasn't great. It's a very different interface to a computer or a mobile phone or a tablet. There's no physical keyboard, and there's no display that you touch to type in numbers or letters. The smart glasses tend to have a display over one eye and a touchpad on the side of your head that you need to try and integrate. And there is a bit of a learning curve there. Hygienically, there's various touch point. There's glasses going to be shared amongst people within the same company, potentially, and also they're going to be shared between our clients. And rightfully, there's some COVID fears and a need to really try and prevent any transmission there. They're not particularly robust, as perhaps you could see in the photo. They're quite delicate. They're delicate because they are light, and we are wearing these things on our head, sometimes for extended periods, and they try to make these devices as light as possible. There's also multiple components, and the glasses come disassembled, and you have to sort of put them together and attach them to the frames. So all of that we thought potentially impacted on how robust they could be. But we worked through some solutions with clients over some of the early attempts we had. Instead of trying to get onto our clients' own Wi-Fi, we include a 4G Wi-Fi device with the glasses. You turn both devices on and they pair, and they automatically connect to the cellular network. And it also meant we had our own independent network now, and we didn't have to rely upon what was happening at our client's end. We did some work to try and simplify the use. We developed a user guide and highlighted a number of shortcuts that came with the glasses so that people could navigate through menus and other such things much more easily. The difficulty in the input method does mean you tend to make a few mistakes, and those shortcuts were really good to get people to backtrack. The devices also come with voice commands, so you can just ask it to open certain apps. And instead of asking our clients to input their username and password for Microsoft Teams or Zoom or whatever the app was that we were using to communicate with them, we just had a Verus account already input on the device. So it was a Verus account talking to another Verus account, and that really meant we could get off the ground really quickly. From a hygiene point of view, we implemented a really robust cleaning regime. Before and after these devices are sent to clients, we have technicians that are all masked up and gloved up and lab coated up, and they will clean those devices with alcohol wipes and other such things, and we work through a really diligent sort of check of that. We also provide some cleaning consumables with the device when it goes to clients, so they can be doubly sure, and they can also clean the device between uses in some cases. And we're also looking at ultraviolet sterilisation in the future to make this even easier and to give our clients even more surety. To help with the robustness, we developed a special carry case, the same kind of thing you see for many items of equipment. And we assemble the unit and put it in this case in some foam and deliver it, rather than asking our clients to assemble the device online. After using these devices for a number of months during those first lockdown, we started to ask ourselves, had it improved our abilities? And fundamentally, we think it does. And the image really is image quality. Some of the things we're able to see from our remote audits using these smart glasses included some unrestrained dangerous goods barrels that were stored at height. These kind of things would have easily toppled over given a nudge from a forklift. We were able to read product names on hazardous chemical containers, and we're able to identify that there are in fact incompatible materials stored in the same area next to each other, and able to rectify that. We were able to see things like the handwritten electrical compliance tags on electrical equipment, being able to verify the date that these things would expire. Similarly, we'd be able to visually see fire extinguisher expiry dates on the tags. These kind of things you would never see with a Google Glass, simply because the image quality was never going to be there. We spent some time with a food manufacturer, and were able to demonstrate plant interlocks in their manufacturing plant, being able to stand back, open up a gate and see all the things that would shut down as a result of those interlocks being breached. We were able to check things like compliance plates on forklifts, making sure that any attachment to the forklift was mentioned on the compliance plate. And we were also able to measure distances between some incompatible gases. A flammable gas and an oxygen cylinder were stored too close, and we were able to clearly see that that wasn't meeting the required distance, and highlighted it. I think the important thing here as well is our clients really felt that these examples of hazards found in the field were a testament to just how good the quality of these glasses were. Many of our clients were very surprised of some of the things we were able to find. But they're not perfect, and there's still a few outstanding issues and some areas where it's not a perfect solution. It's certainly not a perfect solution in some food manufacturing environments, particularly things like meatworks and abattoirs. We find some the big box sort of environments, the big warehouse sheds, can sometimes interrupt the cellular signal. Our cash and transit and banking clients couldn't be convinced that there was streaming video outside of their back of house areas was secure, and so they refused to use it. And I think that's probably justified given their security concerns. It still isn't the easiest thing to use. Certainly, I think as people became more familiar, things did become easier and easier. And certainly, I think over time, as more of these devices are used and people become more familiar with them, there'll be a much shorter learning curve. I'd also just sort of point out software selection can be something you should consider. There's lots of different apps, but unlike, say, a mobile phone where many of these apps are free, these apps can be quite expensive, and you have to pay for a subscription of them each year. Also, remote support, it is difficult when these things break down, and I think we certainly learnt our lesson once or twice about how to make sure they were not going to break down in the field and other such things. And they are also reasonably difficult to use in high noise environments where that integrated speaker can't be heard over the background noise. Would we use these things going forward? Well, I think we would, and I think mainly because it allows us to plan with certainty. We haven't had the third wave in Australia yet, but certainly there is that chance. We have had a number of short-term lockdowns in different states of Australia since Victoria came out of its big lockdown. Victoria had a 5-day lockdown. South Australia, New South Wales and Queensland have all had short-term lockdowns when the COVID numbers weren't looking great. The borders tend to get closed very quickly when that's happening. And for us to be able to continue with the audit programs by simply sending the devices by freight when we couldn't fly there meant that we had some certainty and our clients had some certainty. I think as well, there's also going to be examples where the auditor might be sick, maybe not with COVID, but maybe with symptoms that appear to be COVID, and rightfully those auditors shouldn't be going onto site, but these glasses does give that ability to continue with the audit programs when they were scheduled. I think as well, there is some opportunity to use these things for cost savings. We have many remote regions in Australia where they would certainly work. To date, I think regulators and certification bodies are still coming to terms with remote auditing technology and whether or not the technology is good enough. So I suspect they'll probably be used in the short term more in internal audit programs rather than external and certification audit programs. And finally, I just sort of wanted to summarise what we sort of felt. We think, these kind of glasses do help, do support remote auditing really well, but you've got to get the image quality right. If you don't get image quality right, then none of those other attributes are going to be helpful at all. Battery life is a very close second. That's really important if you're going to stream live video for extended periods. And I think the final point is really just to try and simplify absolutely everything for your end users. It'll help with the take up of the device. It'll help give your clients confidence that the devices are the right kind of things to support their audit programs, rather than them being clunky and difficult to use. I'd like to thank you for listening to this presentation. Thank you very much.
Thank you, Cameron Clark, for that look at the lessons learned on remote auditing during the lockdown. And that concludes this presentation.